Nous sommes en direct du Palais des Congrès de Montréal au JDIQ 2022. J'ai aujourd'hui Dr. Kisby, Lance Kisby du Wisconsin. So, hi, Dr. Kisby.
Hello.
Is it your first time at JDIQ?
First time at GDIQ.
Not the last.
Oh no, I know. I'm definitely marking it in my book. Can I tell you something? The quality of the speakers here, the quality of the questions. I'm not saying it because you're here. I am baffled. I lecture in the United States, sometimes 26 weekends a year. And I visit East Coast, West Coast, and let me tell you, their questions are like, what the heck are you asking? Here, they're intelligent questions which require a 7-minute explanation in order to answer. Because if I said blah, 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 they would say, I don't understand how you got there. So the questions are spot on. They're really energetic here. The people that put this on are absolutely fabulous. I know what it takes to put on stuff behind the scenes. They make it look easy because I've done similar things, but on a local level in the states that I've been in. And I just cannot, how would they make it look seamless? This is, I'm going to let you know, I'm a member of the Academy of Pediatric Dentistry in the United States. I came here not to my annual meeting of the AAPD because there's some more valuable courses here. I hate to admit it, but the quality here is much, much better. No offense to the AAPD.
Wow. So, congrats to the GDIQ team. You were so great. I watched your I watched yesterday your conference and it was so interesting. And you were here speaking about the pediatric stuff like caries and stuff like that. I was amazed and I wanted to ask you a few questions because I wanted to do like a resume, a small resume. First of all, I want to ask you, how do you like to be to GDIQ 2022?
I love it. Now, I've been lecturing for the last 24, 25 years, partly because in the year 2000, they were telling us we were going to have a shortage of pediatric dentists. So I said, well, at that time we had about 16,000. As of now, they had warned us, and it came true, that we only have in the United States about 5,000. As a result, we went from 16,000 to 5,000. And in the year 2020 census in the United States, 24% of all people in the United States are under 18 in the United States. So 80 million people are kids under 18. That's 80 million. If you divide it by 5,000 pediatric dentists, that means each pediatric dentist can only treat 333,000 patients. We can't do it alone. So I've been teaching for almost 25 years to get the word out and show them through hands-on courses or through lectures that the general dentist, it's okay. These kids aren't going to break like porcelain teacups, that it's easier than you think it is. They're only nervous because no one ever showed them how to do it. I would be nervous if someone said, hey, fly a 747, but no one ever told me. I'd be nervous too.
And what was amazing that I find out at your conference is that usually we say, oh, with kids, when they're like 12 months or 6 months or whatever, even 30 months, we don't really do anything before 1 year. We don't go to dentists, but it's so important that, first of all, that before age 3, that we be careful to not to give sugar to our kids. Can you tell us just a little bit more about that?
Right. If you look at our Academy of Pediatric Dental Guidelines in the U.S., which is pretty much what everybody does in the world, the first dental visit is between 6 and 12 months. It's kind of long definition. The first dental visit between 6 and 12 months, even if there are no teeth at 12 months, or when the first tooth comes in, whichever is earlier. So definitely no later than 12 months, but if you have baby teeth coming in, my son's teeth came in at age 3 months, so he went to the dentist, which happened to be me, at 3 months. So most of the time under age 1, the exam is very quick on kids. We take a look. We're looking at eruption patterns, sequence, decay, all that typical stuff. But we spend probably 45 minutes alone on just nutritional education. Are they still breastfeeding? Don't want to be breastfeeding after age 1 because decay rate will go up. It's yes. Human breast milk becomes severely potent for creating decay after age 1.
Nice. And I was amazed to find out that caries is a chronic disease.
Chronic disease. In the old days, in 50s, 60s, 70s, 80s, if you had a cavity, that's what the disease was. That was only the symptom of the disease. We now look at it different. So in the old days, if you had a cavity, we would drill it, fill it, and then they would say, well, problem solved. No. We now treat dental decay as a chronic disease like diabetes or high blood pressure. You never get cured of high blood pressure or diabetes. So because of that, you don't get cured of it. What does your physician do? He manages it. So whether you get a cavity or decay at age 20 or 40, you're now at risk for having cavities for the rest of your life. So what we do now in pediatric dentistry, we have the advantage of what happens at young ages, 5, 6, 7, 8, for example. We know it's going to happen by age 60. And all that research has been out, and we take advantage of that and try to have them not have cavities for the next 80 years. So the secret is to get early dental visits and watch out what you eat, monitor breastfeeding after a certain age, and what's most important is what you said is right. Whatever bacteria you have at age 3 is the bacteria you have for the rest of your life. So if you have cavities under age 3, it means you have a certain group of bacteria under age 3, and once you're over age 3, you can't get rid of them. So the answer is not to get them in the first place. So how do you prevent from getting it in the first place? Is not eating any candy or sweets between the ages of 19 and 33 months. The studies have shown if you eat cavities, so right now we say none, not at all, non-negotiable, no fruit roll-ups, no gummy bears, no shark bites, no gum. And there's a category of foods called SSBs, sugar-sweetened beverages. It's very easy to figure out. The clearer the juice, the higher the sugar. So they're called clear juices because, believe it or not, they're clear juices. So a clear juice would be like apple juice. It has all this additive sugar in it. So the clearer the juice, the higher the sugar. So if you give between 19 and 33 months clear juices, like apple juice, you're going to have cavities by the time you're 3. And now you're going to have it for the rest of your life.
And can an adult, like a mother, can give the disease to her kids?
Yes. When a baby is born, in fact, we have even other interesting risk factors. Now, I'm going to say it, but it's just a risk factor. It's on paper, but there are other things here. You know, your car doesn't work. You don't assume that you buy a new one. Maybe you didn't put gas in it. Well, it's the same thing with this. Where does the bacteria come from is a good question that all the moms ask me. If my kid is 2 years old, where do you get the bacteria from it? It's transmitted from parent to child. So if a mom has never been to the dentist in the last 10 years, she probably has a high bacterial count. It tends to be the bad bacteria. When she kisses the baby, and how many times are those of us that have been parents, 2-year-olds in the high chair, you want them to eat the applesauce, and they go like this, and then you put it in your mouth to show them it's not that bad, and you scoop it back in, and now that you're giving your bacteria to them. So it's a transmissible disease.
Can you give us some stats on caries?
Caries in children is the most common disease in children is dental decay. It's 7 times more prevalent than asthma in kids. More kids lose time off from school, not from the common cold or being sick. They lose more time from school due to dental pain. 10 times more than the cold.
I guess that when you have that disease and you have caries, it can give you other problems, health problems?
Other health problems. Because of having dental decay, one, because of the pain, the kids tend not to eat well, and if they don't eat well, they don't grow, and when they don't grow, they're shorter, they don't sleep well. Parenthetically, it's very interesting. When I do kids that are very young that have so much work to be done, it would be cruel to do it in the chair, so I have hospital admitting privileges, so I do it in the operating room. 1 day a week or 2 days a week, I do 2 patients each day in the OR, and they're 3 or 4 hours each, and they're all under 4. So sometimes out of 20 baby teeth on a 4-year-old, I can work on 18 or all 20. I can extract 17. One patient I took out, so they only have 3 more teeth left until they're 12 or 14.
And you were saying that you try to avoid drilling the teeth because every time you drill a teeth, it's like $20,000 per teeth. If you go until, can you explain this to us?
Yes. The trend now is to avoid drilling. We have very interesting things out now that came out in the United States in 2016, I think in Canada in 2017. It's called SDF, silver-diamine fluoride, SDF. I know it sounds kind of weird, but here it goes. If you have a cavity on the top of the tooth, I'm going to make it easy for you. On the top of the tooth, it looks like water. The patient comes in, let's say we have one tooth to do. We put it on the tooth for 3 minutes. It kills all the bacteria, the decay instantaneously. The decay process stops. We have them come back 4 weeks later and we do it again. 3 more minutes. Come back 6 months later and we do it another 3 more minutes, and that's it. You stop the decay process, and even if you have a hole, you don't have to fill it. So there's a new generation of kids that we hope will never experience to know what dental decay is and have to have the drilling and Novocaine in the injection. So this has really, my drilling since 2016 in the U.S. has dropped 90%. I do 90% less drilling now because I do a lot of SDF. The kids, they come in, they have a positive experience. We give them a nice sticker and some prizes, and they're all happy.
Oh. And it costs less to the parents, I guess.
Very, very much less. Average price of a filling versus SDF, it's a $300 savings per tooth. So to answer your question, once you start drilling a tooth on a kid at age, this is why we have a different perspective than, let's say, adult dentists, because we know what happens in 60 years, is that if you drill a tooth today on a 6-year-old, by the time they are dead, each tooth will have cost $20,000 right now in today's dollars, $20,000 over the life of that tooth until the patient is dead. I have patients that I've done 10, 18 teeth on a kid with permanent teeth, and you're talking almost $500,000 by the time they're dead spent on teeth. You could buy 2 houses with that. Not in Montreal, but you can still buy 2 houses.
God. Oh, thank you so much. It was so interesting. I think that you should even speak to the grand public because, yeah, I'm telling you, as a mother of 3, I would have liked to know this way back ago. It was very interesting. Thank you for being
Thank you
here.
very much for inviting me.